Hi, guys. Thank you for joining us for Sexual Health Awareness Week. We are the Peer Health Owls, and we're going to do a quick Q&A session with questions that were submitted to us last week. As a reminder, we are not experts, so you should always speak with your physician about any specific concerns. My name is Janelle Eccles. My major is public health, and I'm a senior.
My name is Tasia Robinson. I'm a nursing and human services major, and I'm a junior.
And I'm Delita Brown. I'm the Health Promotion Coordinator in Health Promotion and Wellness, and I will be moderating today and adding in little bits of information here and there.
And my name is Laura Nichols, and I am the intern with Health Promotion and Wellness, and I'm currently getting my master's degree in public health. So now we're going to jump into y'all's sexual health questions. So first we have, what is sexual health?
The World Health Organization defines sexual health as a state of physical, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence.
Okay, and why is sexual health important?
Okay, sexual health is important because it contributes to your overall well being. Paying attention to your sexual health puts you in charge of your physical health, reproductive health, and your emotional well being.
And why does it hurt when I am having sex?
Pain during sex can be caused by many different things. If you're experiencing pain, it is best for you to contact your doctor and explain to them what exactly is going on.
Okay, next, how effective is birth control?
Different birth control methods have different levels of effectiveness. For example, condoms, which are probably the most common and are the only birth control method, well, it's the only birth control method that prevents both pregnancy and transmission of STIs. And it can be anywhere from 87 to 97% effective because there is a lot of room for user error. But methods like the implant or an IUD are 99% effective because there is very little room for user error. um, those two are considered the get it and forget it, meaning once they are inserted by your physician, they require very little maintenance until it is time for it to be removed.
And going off of that, what are my options for birth control?
There are so many options. Some of the more common options are condoms, both internal and external, which are also known as the female and male condoms, available on campus through the condom concierge. There's the pill, the shot or depot, the patch, and the ring. There's also an emergency contraception or Plan B that can be used if your other birth control method has failed.
You should always speak to your healthcare provider about which method would be best for you, but bedsider.org is a great website to check out different birth control methods and learn about how they work. Planned Parenthood also has a quiz that you can take to help determine which method would be right for you.
Those are great resources. So how can I talk to my partner about these birth control options?
It is very important to be on the same page as your partner. Let your partner know which methods you currently use or are open to using and ask them the same. Make sure you establish boundaries for yourself and then come to an agreement on which method will work best for the both of you. If talking about birth control makes you nervous, practice the conversation until you feel comfortable.
Okay, and how can I talk to my partner about STIs?
This can sometimes be an awkward conversation, but you want to make sure that you talk to your partner before engaging in any sexual activity. Explain that being safe is important to you and establish boundaries. Try asking some of the following questions. When was the last time you were tested? Are you willing to go get tested together? Do you usually use condoms and or dental dams?
And this actually leads to our next question. I want to make sure that my partner and I get tested before we have sex. Where should I go?
Okay, so there are plenty of options. You can always visit your primary care physician. Some insurance policies allow for free testing during your physical exams. If you are uncomfortable getting tested at your doctor's office, or if you and your partner want to go together, you can be tested at local health clinics or your local Planned Parenthood office. Some of these places do offer free or low cost testing. And also the Health Promotion and Wellness Office also hosts free HIV and hepatitis C testing events on campus throughout the year.
You can also check out healthysexuals.com for some icebreakers to get the conversation started.
So how often should I be tested for STIs and which ones?
The CDC recommends being tested at least every 6 months and with each new partner. As far as which STIs you should be tested for, that is a conversation to have with your physician. Some physicians test for different things, so if you're wanting a specific test, be sure to let them know.
So if I get tested, will my parents be notified?
Okay, so your parents would not necessarily be notified when you're tested, but if you are using insurance, there's a chance that it will show up. If you are concerned about your parents knowing, try visiting a health clinic or a free testing site instead.
And this brings us to our very last question. Is it necessary to get consent for sexting?
Absolutely. It is important to obtain consent from your partner before any sexual activity. No one wants to randomly receive unsolicited pics or graphic texts.
All right, thank you guys. That concludes our Q&A session. Thank you to everyone who submitted questions. If yours was not answered here today, or if you have another question, feel free to email us at phe@kennesaw.edu.